Name's Matthew Harmon from LodgeNet Healthcare. We're here to talk about patient engagement today, and our presentation is focusing on the 5 W's of patient engagement and the H. And the H is not for Harmon. Common mistake, misconception. So what is patient engagement? Well, there are many new regulations that are being handed down by the government and the Joint Commission and various quality assurance bodies in healthcare that are trying to focus on primary objectives, improving quality of care while cutting costs. Evidence-based approaches have determined some of the requirements that are associated with these regulations, and the common denominator in all of them is patient engagement. So we're trying to get the patients engaged in their health care. This is really what we're talking about. We're trying to take Joey Wickham, who is our candidate that we are using. It's a fictional person in case there's anybody that watches this video with the last name Wickham. Joey's a fictional person that we've made up, a patient at our Corinthian Pediatric hospital. And what we're trying to do is we're trying to take Joey from a person laying in the bed who's either sick and maybe not getting better, or is sick and getting better, to somebody that's trying to get better, somebody that's forgetting about the fact that, hey, I'm laying in a hospital bed and I may be 10 or 12 years old. And certainly with patient engagement, it doesn't matter what age they are. We want everybody to be focused on improving their care personally and getting involved with the process and trying to help assist the clinical care staff in making that happen. Moving on. So patient engagement, we did discuss that a little bit. Over 70% of hospitals do not have a formal definition for what we would call the patient experience. Now, we found that a lot of hospitals today are starting to have this definition defined. They've developed committees and people internally to try to delineate what this should be. So as it's gaining traction, it's gaining momentum, and it's becoming an issue that is coming to the forefront in a lot of medical centers, both pediatric and acute. Their definitions do vary. They can vary, very widely. They can be a narrow variation, but everybody describes the patient experience to what they feel is best for them. 90% of the hospitals describe improving the patient experience as one of their top 3 goals, system-wide. And it doesn't make a difference how it is defined. We know that there's 4 key components that we need to effectively engage the patients. What we would call the 4 pillars of patient engagement are defining the patient role, granting control of the care process to the patient in a limited fashion, educating the patient, which is one of the biggest pillars that we have, and transitioning the patient. Much too often as a patient leaves the care process in the facility, they become disengaged with continuing the process to make themselves better or to maintain the healthy lifestyle or dietary regulations that have been prescribed to them. These are all built, all 4 of these pillars that we're discussing are built on evidence-based principles that are grounded in research. And while they may look a little different in a children's hospital, they are every bit as important in a normal acute care hospital as well. So the solution that LodgeNet has developed to assist with patient engagement, to help define it, help maintain it, is our eSuite program. eSuite is a solution that includes a module called Express, which engages the patient prior to arriving at the hospital for their care process. Engage, which we're trying to engage the patient while they are in the facility. And Extend. And Extend is our post-discharge module that we're trying to help continue the care process after they leave. Our eSuite solution is the most consistent, financially viable solution on the market. It can be utilized typically using existing infrastructure in a hospital with very limited infrastructure overhaul involved. As I mentioned, it's very, very cost effective, and it's by far the most stable on the market. And this can really greatly improve the inpatient experience while somebody's there through the engagement, through the education, and through entertainment. Studies have determined that the best place for engagement to happen is in a hospital. And why? Because a patient is typically laying there trying to get better. A patient in a hospital bed is the most captive audience that anybody could have. So from an educational standpoint and improving care standpoint, you've got them trapped almost. We found that TV is the best delivery mechanism for this, and certainly LodgeNet is not alone in that. There are many different vendors that are using televisions to try to inform, educate, and deliver information to patients. The one nice thing you'll find about utilizing something like a TV is that you limit confusion to a patient. You know, if you've got a foreign-speaking patient, maybe they speak Spanish, Russian, you know, we can prescribe content and find content that there is available out there to deliver that message educationally to the patient. So now you're limiting the barriers that you may have from a clinician that doesn't speak Russian or doesn't speak Spanish. And you're certainly limiting by not printing the materials, you're limiting any possibility that maybe the patient doesn't read very well or maybe they don't read at all. So you're eliminating that. And certainly everybody's familiar with a TV because you probably can't find any home in America that doesn't have a TV in just about every room anymore. So LodgeNet has been doing this now for about 6 years, but the company has been around for over 30 years engaging not patients, but engaging people. So we understand the science of how to get somebody to interact with your system. And one of the ways to do that is, I apologize here, I lost my place. In the pediatric space, it is absolutely critical to get people to be engaged. And we've done studies and done internal research that has allowed us to figure out some of the best methods to do that. So what we've done is we've designed some content that is specific for pediatrics. And this content is both fun, it's educational, very easy for a child to understand or a juvenile or adolescent. The content is clearly in the places that it should be. So far we've discussed a lot about education. One of the things that's most important in a pediatric setting, because that's where we are, is to entertain the patient. A lot of times kids aren't really that interested in watching the education piece. Now, mom and dad are going to learn greatly from it, but maybe little Joey Wickham is not going to do well sitting around watching a lot of videos on his care. Now, the juvenile videos that we do provide certainly make it relatable for Joey, but certainly wouldn't be the most fun thing for him to watch. So one of the things that we do have available in our eSuite solution is a lot of entertainment options. They can watch movies, they can listen to music, play games, both a Nintendo game, as well as some simple on-screen games that they can play utilizing the directional pad on their pillow speaker. They can also access the internet. All big things that help keep somebody engaged while they're in there. So one of the things that we also think is it's important to try to grant children and patients in general some control in their care process. Now, we can't let them control everything. They're still going to be prescribed education, and they're going to be prescribed medication as well. But one of the things we can't let them control is their meal order. So through the eSuite solution, patients can go in, order the meals that they want, and through the system we'll actually promote the fact and we'll provide a matrix that says, okay, Joey's not allowed to have a high salt content food. He's on a clear liquid diet. He's on a brat diet. You know, the system is smart enough to gather that information, present it to Joey, so we'll actually prevent him from ordering something he's not able to do. So we can and do provide dietary restrictions. But having the ability to choose what Joey's going to eat for dinner is pretty big. It's probably pretty exciting for Joey, and it certainly helps keep him involved and engaged and active. My Care Team is another product that we have that is typically included in our solution. And what My Care Team does is it provides an interface, if you will, for the patient, a graphic interface for the patient to view on their TV who the current pediatrician is on the floor, who the staff nurse might be, patient care technician, members of the IV team. And what it does is it provides a picture and a quick biography about these people. So it just assists in when these people walk in the room, little Joey knows who they are. And Mr. and Mrs. Wickham also know who they are. So when Tom walks in, they recognize the fact that he's the pediatrician that's on staff that day and is going to provide the care for Joey. Another way that we engage them is through My Schedule. Now, in a pediatric facility, My Schedule is a very important piece because a lot of times patients and their families don't know what they're going to have to look forward to the next day. So for Joey, he may not understand that he's got some rounds of testing that need to be completed, and mom and dad may not be sure what that testing is. So utilizing a piece like My Schedule can allow the family to go in and view what is on tap for Joey for the rest of the day or for the remainder of the care process, however it wants to be set up. And by providing that information, if Joey's unable to understand what he's going through, mom and dad can typically understand, and they can explain it in a manner and in a language that's familiar to Joey that will help him ascertain really what is going on at that point in his care process. Education, what we would have as the third pillar in our 4 pillars of patient engagement. What we've done to engage the patient here with the education in a pediatric setting is we've worked with a company called Health Nuts Media to devise educational content that is both pertinent and understandable to pediatric patients. We want them to have an understanding, even as kids, what their condition is, how they're going to get better, and how long they may be affected by this. We do have a robust library of, I would say, hundreds of titles from most vendors. I happen to mention Health Nuts because they are here at the show with us, and we do a lot of pediatric content with Health Nuts. Studies have shown, like I mentioned before, that video is the most effective way to deliver educational content to a patient. And part of the reason we've worked with Health Nuts in the past is we recognize the fact that it would be difficult in some instances for Joey to understand educational content that may be developed for somebody who is an adult, older, maybe a 50-year-old. I use diabetes as an example quite often. Joey may not be able to relate to the fact that he may have had juvenile diabetes. He may not be able to relate well to the 50-year-old diabetic video that's going to be placed on there for mom and dad to see. So we decided that, and we're not alone in this, that it's important to be able to translate that information well to a younger patient. I mentioned Health Nuts Media before. I won't go too far into Health Nuts, but Health Nuts, if you're not familiar with them, they have a character named Daniel and his sister, and they've brought them to life on the screen to help interact with these kids. Something that they can relate to, educating them on common health concerns like vaccinations, dehydration, asthma, diabetes. Delivery matters. So LodgeNet's delivery of entertainment, education, all of these tools we use to empower the patients to take a more active role in managing their care process. But having the tools isn't enough. They have to be consistently and constantly delivered. LodgeNet's system has over a 99% uptime. How we're different, our system architecture. We can deploy it on both an IP system, a network solution, or over your existing cable coax. Our solution does not require a PC to be in the patient room. We can leverage your current investment, so we don't have to have a great, tremendous infrastructure upgrade like I mentioned earlier. Professional services, our professional services team are located throughout the country. Because of our unique relationship in the hospitality industry, we have service folks all over the country. And service and support. All of our service and support is fed by a nationwide team of field service people. And our call center is staffed 24/7 in Sioux Falls, South Dakota. Our solution is also, we actually not back up, but we run a report on every single TV in both hospitality and healthcare that we have around the world every single night. And typically we can identify problems that the system is having or that an individual TV may be having prior to anybody else even knowing about it. So this is where our 30 years of experience comes into play, making us a very strong partner in healthcare. So the result of some of what I talked about, an empowered patient. Hopefully we can help minimize patients' fears, increase their satisfaction by providing them something to do while they're in the facility, getting them better education, providing a safer inpatient environment through some processes like My Care Team, improving the clinical outcomes, and increasing operational efficiencies to hospitals, and providing more clinical care time to the clinicians. So if anybody has any questions here, or if you end up watching this video, please visit LodgeNetHealthcare.com. And does anybody have any questions here?